Hey guys, I am Carly Fielding and I will be focusing today on hepatitis A, B, and C for my presentation. Hope you guys like it. We will begin by discussing what hepatitis means in general. So generally, hepatitis means inflammation of the liver. Now in this presentation, the hepatitis that we will be discussing is caused by viral agents. The types of hepatitis is named based on the virus that caused it, and forms can range from mild to serious, and they can also be either acute or chronic. Now here I have included a picture that compares a healthy liver to an inflamed liver, just so that you guys can see what type of damage hepatitis can have on the liver. Hepatitis was first discovered in the 1950s by Dr. Baruch Blumberg, and this was discovered by accident when Blumberg was researching genetics of gene susceptibility. Blumberg was able to detect an antigen of hepatitis B virus, or HBV, in a blood sample that he was analyzing. This virus was officially recognized in 1967, and 2 years later, Blumberg and his colleague Dr. Irving Millman were able to develop a vaccine for hepatitis B. Later in the early 1970s, the virus that causes hepatitis A was found and rightfully named hepatitis A virus, or HAV. The hepatitis C virus, or HCV, was found and isolated in 1989. So that one is the newest of the three that we are discussing today. This picture is what a hepatitis virus looks like under a microscope. I am not 100% sure if this is hepatitis A, B, or C, but this was just the clearest picture that I could find, so I wanted to include it in the presentation. So first we will discuss hepatitis A. The hepatitis A virus is a non-enveloped RNA virus, and it is a member of the Piconaviridae family. Sorry if I mispronounced that. This picture shows the structure of the hepatitis A virus. In depth, I think it does a pretty good job of showing its non-enveloped structure. So Hep A virus actually replicates the liver, and it is excreted in the bile, and it can be found in stool concentrations up to 2 weeks before the onset of symptoms. And once symptoms do show, the amount of virus that can be detected in the stool decreases within 1 week. I wanted to point out that the mechanism of the HAV virus is not completely known. So even though the mechanism of the virus isn't quite known, I did want to point out some facts about the virus. So HAV is relatively resistant to heat, though it can be inactivated at very high temperatures. It is also resistant to detergents and organic solvents, so some household detergents that you can find. And also HAV can survive in extremely acidic environments. Now, it can be inactivated with hypochlorite and ammonium formulas that contain HCl, and hypochlorite is bleach. Clinically, hepatitis A is not diagnosable. It needs to be diagnosed through different lab tests. So in these tests, the detection of IgM antibodies to hepatitis A virus in a single acute phase serum sample is what we are looking for. Symptoms of hepatitis A include fatigue, nausea and vomiting, abdominal pain, clay-colored stool, loss of appetite, fever, dark urine, joint pain, jaundice, and itchiness. So jaundice is a good indicator that there is something going on with the liver, and it displays with the skin and the eyes and sometimes the nail beds appearing a yellow color, and that is what we're seeing in this picture here. So you guys can see his eye or her eye has this yellow hue to it, and that is what we refer to as jaundice. Those who are at a higher risk for developing hepatitis A are travelers to regions with high to moderate risk for hepatitis A, sex contacts with infected persons, caregivers of infected persons, male sex, users of certain illegal drugs, which can be injected or non-injected drugs, and also people with clotting factor disorders. So these at-risk individuals, this list that I have here comes directly from the CDC website. As far as epidemiology, there are an estimated 1.4 million new cases of hepatitis A that occur globally each year. As far as the US, I just wanted to briefly touch on an outbreak in California as recently as 2017. In this outbreak, there were over 650 people infected with hepatitis A, 421 known hospitalizations, and 21 deaths. This was one of the largest outbreaks in US history and was the largest outbreak in the United States in the last 2 decades. As far as treatment goes, there is not a specific treatment for hepatitis A. Usually the body's immune system will clear this virus on its own, and the liver will heal within 6 months. Generally, there will be no lasting damage to the liver. Sometimes symptoms may need managing. That could include anti-nausea meds, rest, being careful and cautious with prescribed medications, avoiding alcohol and sexual activity, washing hands thoroughly and frequently. And although this isn't really managing symptoms, I also just wanted to note that those with hepatitis A should not be preparing food for others. One prevention for hepatitis A, there is a vaccine, and this vaccine is administered in high-risk areas, mostly to children. We will now begin discussing the hepatitis B virus. So the Hep B virus is an enveloped hepatinovirus, and its viral particles can form either spherules or tubules. This picture depicts the structure of the Hep B virus, so I wanted to include it because it does a pretty good job of showing its size as well as its components. As far as the mechanism of action for this virus, attachment of the mature virus to the host cell membrane occurs first so that the virus can enter the cell through the cell wall. Entry of this virus into hepatocytes is mediated by proteins called pre-S proteins, and once this virus has entered the cell, its viral genome is uncoded, and what's called relaxed circular DNA is released into the cell. So I mentioned earlier in the presentation that hepatitis can be either acute or chronic, and hepatitis B is one that truly is either acute or chronic. Acute hepatitis B is Hep B that lasts less than 6 months, and usually this acute infection can be cleared by the immune system without any additional treatment or therapies, and the body will experience a full recovery in just a few months. If the body is not able to clear acute hepatitis B, it can lead to chronic Hep B. So chronic Hep B lasts 6 months or longer, and the immune system is not able to fight off the infection on its own. Treatment and therapies will need to also occur. Chronic Hep B can last a lifetime, and it can lead to liver damage, liver disease, liver cancer. As far as diagnosing hepatitis B, blood tests can be performed in order to diagnose this virus, and these blood tests can determine if the Hep B is either acute or chronic. Liver ultrasound can also be performed in order to determine how much liver damage has occurred. Now, symptoms of hepatitis B include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness, fatigue, and once again we see jaundice as a prime symptom. So we'll now discuss the epidemiology of hepatitis B. So I'm not going to read this entire list of who is at risk for Hep B. Once again, this list comes directly from the CDC website. A few things that I did want to point out, just some differences that we see in this list compared to Hep A. For Hep B, those at risk could be infants born to infected mothers, so that's one difference. Also, drug users that are at risk for Hep B are those that use injection drugs, not injection or non-injection drugs, as well as those that just have regular household contacts with infected persons. Hep B is also more prevalent in healthcare and public safety workers that are exposed to blood on the job. It is estimated that there are 350 million cases of chronic hepatitis B worldwide, and in East Asia, approximately 20% of the population is infected with the Hep B virus. As far as treating hepatitis B virus, if one has a known exposure to this virus, then an injection of immunoglobulin antibodies can be given within 12 hours of the exposure, and this can help prevent a true infection of the virus. Treatment's usually not necessary for acute Hep B. Usually, as I said prior, the immune system can clear this virus on its own. Treatment for chronic Hep B is usually required throughout the lifetime. And this treatment, although it won't cure the virus, it can help reduce the risk of liver disease and damage, as well as the risk of the infected person passing along this infection to another individual. And treatment for chronic Hep B includes antiviral medications, interferon injections, and in some cases, liver transplant may be necessary. Lastly, we will discuss the hepatitis C virus. So this virus is an enveloped single-stranded RNA virus, and it is a member of the Flaviviridae family. Once again, I apologize if my pronunciation on this is off. This is a picture that I have provided that depicts the structure of the hepatitis C virus. The mechanism of action for this virus is low-density lipoproteins, which are required for viral particle assembly and secretion. So once this particle is released and secreted, the virus will circulate throughout the blood as a triglyceride-rich particle, and it can infect cells by using lipoprotein receptor-dependent mechanisms. As far as diagnosing hepatitis C, this can be done through what is called a hepatitis C antibody blood test. Additional blood tests can also be used that can measure the quantity of hepatitis C within the blood, and this quantity is referred to as the viral load. Additional blood tests can also be performed in order to determine the genotype of the virus. So symptoms of hepatitis C, similar to the other two, they include flu-like symptoms, so fatigue, sore muscles, joint pain, fever, nausea, poor appetite, stomach or abdominal pain, itchiness, and a rash, as well as dark urine, and we see jaundice again. This picture shows what a rash that stems from hepatitis C virus could look like. So as far as those at risk for developing hepatitis C, once again, this list comes from the CDC website directly. The ones that I wanted to point out that are a bit different from hepatitis A and B are those who are either current or former injection drug users, those that were recipients of clotting factor concentrates before the year 1987, as well as recipients of blood transfusions or organ donation before the year 1992. Those at risk could also be long-term hemodialysis patients or those that are infected with HIV. So as far as epidemiology, there are over 130 million people infected globally with hepatitis C, and most of these are chronic infections. Now, this number is a rough estimate as many countries lack data on this virus. This is more of a regional estimate here. And I also just wanted to point out that infected people serve as reservoir for transmission of this virus to others. Treatment for hepatitis C consists of antiviral medications, and there is a new antiviral medication that is called direct-acting antiviral meds. In some cases, liver transplantation might be necessary depending on the damage. One really important thing that I wanted to point out here is that there is no vaccine for the hepatitis C virus, but those with high risk exposure to this virus, it will be recommended by their physician that they do receive the vaccines for both hepatitis A and B. So that concludes my presentation today on hepatitis A, B, and C. I hope that it was informative and that you guys liked it. Thanks, guys.